A saying by Rodolphe Virchow, known as the father of modern pathology. He said, cellular pathology is not an end if one cannot see any alteration in the cell. Chemistry brings the clarification of living processes nearer than does anatomy. Each anatomical change must have been preceded by a chemical one. Pathology is a scientific study of diseases. In this study, you will learn about the structural and functional changes in disease. For the understanding of pathology, you should know anatomy and physiology, and for the structural and the functional abnormalities to understand, right? So in pathology, you will deal with the knowledge of what causes disease, how disease starts, how it progresses, and what could be the signs and symptoms of patient. Now, what is disease? Dis-ease is an expression of discomfort to structural or functional abnormality. Diseases which present at birth are called congenital diseases, and the remaining diseases are categorized as a acquired disease. The abnormality or the disease can be caused by various agents, for example, bacteria, viruses, heat, radiations, etc. And collectively this is called etiology. So etiology basically is the cause of the disease. Then for the etiology, there are two types of factors that can cause any disease. One could be the environmental or external factors, and the other one is the genetic or internal factor. Now, pathology of any disease is basically studied under 4 subdivisions. Number 1, etiology. Number 2, pathogenesis. Number 3, morphology. And number 4 is clinical significance. Etiology means, as you know, that it's a study of cause or the causative agent of disease. Then pathogenesis is the progression of the disease, how a disease will progress or evolved. Then morphology, in which you will study the structural changes occur grossly and microscopically. And in clinical significance, you will study how a patient will present it to you like manifestations or the sign and symptoms of a patient. Major groups of diseases are inflammatory, degenerative, and neoplastic. So these are the major 3 groups of diseases which you can study. In inflammatory disorders, it is due to the damage of tissues by various injuries like physical, chemical, infectious, etc. Autoimmune comes into that category, right? Then degenerative disorders are due to the lack of growth or aging factor. Then the third category is the neoplastic disorders, in which you will study the excessive cell division which forms tumors. Now this is the book for pathology which you are going to study. Robinson Cotran, Pathologic Basis of Diseases. In this book, we first cover the principles of general pathology and then proceed to specific diseases, organ or system related. Traditionally, the study of pathology is divided into general pathology and systemic pathology. In general pathology, you will study the different general features of tissue injury and its response. And in systemic pathology, you will individually learn about the diseases which categorize into different organ related diseases. General pathology is concerned with the common reaction of cells and tissues to injurious stimuli. Such reactions are often not tissue specific. For example, acute inflammation in response to bacterial infections produces a very similar reactions in most of the tissues, right? In systemic pathology, you will examine the alteration and underlying mechanisms in organ-specific diseases, for example, ischemic heart disease, which is caused by atherosclerosis, right? Appendicitis, caused by bacterial infection. So it is going to be other way around. First, in general pathology, you will learn the general features, and in systemic pathology, you will take one by one organ and tissue and its related diseases. So these are the different branches of pathology which you are going to study in pathology. Number one is histopathology, then hematology, then microbiology, and chemical pathology. In histopathology, you learn about the different changes occur structurally at tissue level, cell level, and at the molecular level. Then in hematology, you will learn about the diseases of blood. While in microbiology, you will learn about the microorganisms first, general microbiology, and then you will learn about the specifically you will take one organism and then you will learn about the disease which it causes. So basically you will see a disease through a perspective of microorganisms. Then in chemical pathology, you will learn about the biochemical investigations of bodily fluids such as blood, urine, and cerebrospinal fluids. So you will basically learn chemical pathology in your practicals mostly. Now the second topic which I am going to tell you is an overview of cellular response to stress and noxious stimuli. It means that how cellular cell will respond to any injurious agent, right? So as you all know that the normal cell is specific, each and every normal cell is specific in range of function and structure, right? Because of state of metabolism, because of its differentiation, its specialization, and the availability of metabolic substrates. What is differentiation? This thing will be a new thing for you. Differentiation means how much it is resembling with its forefather. Whether if you are looking at skeletal muscle, then it should look like a skeletal muscle, and if you are looking at the smooth muscle, then it should look like a smooth muscle. That's why you are calling it, that you can differentiate that it is a smooth muscle or skeletal muscle. So this is called differentiation, right? Otherwise it won't handle the cell won't handle physiological demands maintaining a steady state called homeostasis. So because of these things, these above four things, a cell can perform its normal function, otherwise it won't, right? So this is a normal cellular cell structure and function. Now these are the different responses a cell can present it to you due to the mild to severe injurious agent. And number one is adaptation. So cell can survive and continue to function, but it achieves a different steady state or altered state of itself. So adaptation is functional, reversible, functional and structural response to changes in physiological stage. Adaptation can be caused by due to normal physiological stimuli, or it can be due to pathological stimuli. For physiological state, you have an example of pregnancy in which uterus enlarges and go back to its original size when the pregnancy overcomes or ends. And some pathological stimuli during which new but altered steady states are achieved, and cells survive and continue its function. So there are different types of adaptations. Number one is hypertrophy. It can go to hyperplasia. It can go to atrophy or metaplasia. We will discuss it inshallah in the next lecture of adaptations. What are these adaptations and how you can differentiate between them. When the stress is eliminated, the cell can recover to its original state without having suffered any harmful consequences. Now the second entity after adaptation is cell injury. If the limits of a cell for adaptation exceeds, then it goes towards cell injury. Or you can say when the injurious agent is very harmful or beyond its limit, then cell will go into the state of cell injury. Cell injury can be of two types. One is reversible and the other one is irreversible. Now for cell injury which is reversible, it is of course up to a certain point, but if the stimulus persists or is severe enough from the beginning, the cell suffers irreversible injury and ultimately undergoes irreversible injury, that is cell death. Then adaptation, reversible injury and cell death may be the stages of progressive impairment following different types of insults. The cell death or the irreversible injury of a cell in response to any injurious agent is the last entity that a cell can present. It is the most crucial event in the evolution of disease in any tissue or organ. There are many causes of cell death, including ischemia, that is the reduced blood flow due to the infections by any microorganism, due to any toxins. So these are the different causes of cell death. Just like the adaptation, cell death or irreversible injury is also not only pathological, but it is also physiological process. So you can see the cell death in embryogenesis, in the development of organs, and for the maintenance of homeostasis. Now there are two principal pathways of cell death. One is necrosis and the other one is apoptosis. But in some conditions, you will find that a cell sometimes gives you nutrient deprivation, and this nutrient deprivation triggers an adaptive cellular response which is called autophagy. It means cell eat itself. So it leads into cell death. Now this is the example of a cell response against any injurious agent. For example, in response to increased hemodynamic load, it means the heart is bearing too much blood. The heart muscles become enlarged. This could be due to any reason. One of the reason is hypertension, right? Or diluted blood, or regurgitation. So a form of adaptation that occurs, it leads to increase in the size of the heart muscles or the myocardium. So if the blood supply to the myocardium is compromised or inadequate, the muscle first suffer reversible injury that is manifested by the enlargement of the cells, that is hypertrophy. And when the insult continues or the injurious agent remains or persists, then it will lead into necrosis of that area. And this is called the irreversible cell injury or the death of the heart muscle. So after discussing different responses of cell against any injurious agent like adaptation, cell injury, reversible injury, irreversible injuries, you will find some other entities or topics like intracellular accumulations. In this entity or topic, you will learn about the metabolic derangements in cells, and sublethal or chronic injuries may be associated with some accumulation of different substances inside the cells, which includes protein, lipids and carbohydrates, sometimes calcium or sometimes wear and tear pigments. So you will learn about intracellular accumulation in the last of this chapter. So this was all about the summary of cell injury and its response. Then this chapter will be over. Now this is the schematic diagram of the cellular response to stress and injurious agent. You can see a normal cell in the homeostasis. When there is a stress is occurring, then stress can lead into adaptation or it can directly go towards cell injury. Adaptation also can go towards cell injury if the stress persists. And cell injury can be of reversible type or it can go towards irreversible injury, that is cell death, necrosis and apoptosis.